it is our nurses, our future. Caring for nurses strengthens economy. That implies that the health and the well-being of a healthy nursing workforce, is critical in supporting the overall healthcare system here in Nigeria, or worldwide, I should say. Does that presuppose that isn't the case currently in Nigeria as we have it?
Thank you, Mr. Moderator. First and foremost, let me appreciate Nigerian Television Authority, the management and staff for celebrating with us this year 2025 International Nurses Day. And at the same time, I bring greetings from the #1 political nurse in this country, in person of Comrade Nurse Haruna Mama, the national president of our dear association, National Association of Nigerian Nurses and Midwives, and at the same time, our digital general secretary, in person of Dr. T.A. Setima, who is the general secretary of the association, okay, and the other distinguished NAC members. I am Comrade Nurse Samuel Olimide Faniran, the National Auditor 1, representing the National Administrative Council of NAM at this studio today. So I want to appreciate you, sir. And with the question raised, we are talking about future. That means in the present situation we find ourselves, we have not reached the expected outcome that we are looking at. And we are like over 5 years now, we have been talking about future as leaders, but last year we talked about economy. So this year we are now...
Indeed, I was going to say that 2024 was on the economy,
yes,
but you seem to have hurriedly moved on to the well-being and safety, or rather the health and well-being of nurses this time around.
Yes.
Why jump? One would have expected a consolidation of where you were or what you did last year, but you seem to have shifted focus this time around.
It's a continuity, sir. We said we want to strengthen the economy now, because we have talked about...
So there's still somewhat of a linkage.
Yes, there is a link between last year and this year, because last year we were talking about economy, how nurses can improve and generate the economy. But this year we want to strengthen it, to have it more than what we have last year. And in that situation now, we are looking for the future. How can we compete with the global world in this country? We know we are trying, we know we are moving forward, but comparing with the Western world, we are still lagging behind. So that's why this year we are talking about how to strengthen the economy through caring for nurses. And if we look for nursing profession in the health industry, we constitute roughly 75 to 80% of health workers. So investing in nursing, in their well-being, we strengthen the economy. And we are talking of indirect implication now. Somebody somewhere might be thinking of, we are talking of cash, we are talking of money. No, we are talking of the outcome, the input to the caring of our patient. So we want to strengthen our economy through the well-being, through mental health support, through the good environment for the work we are doing, and provision of the materials needed. And at the same time, compensation for nurses in the country. So through this, we have a resultant effect on the economy. So as we go on, we will elaborate more.
I was hoping, yes, I know you've talked about the future, or rather the target is the future. I wanted you to talk about where we are right now in terms of some of these targets that you've mentioned. You've talked about, in fact, you elaborated, or you inferred the general wellness and well-being of nurses, and then you identified certain objectives. So I would like for you to take one or two of these objectives, but then just oppose where we are right now with the future targets and objectives, even if it's one or two of these targets, and then we can move forward.
Thank you, Mr. Moderator. Let me first of all appreciate the government of this country for the little they have done in the health industry. But we still have a lot.
Little? It's not plenty?
Well, let me say it's still little.
Considering...
Because a lot is expected. Okay. A lot are expected from our government. But they are doing their own best, but their best is not yet the best to us. Because, let me start one example. When we are talking of professionals, nursing as a professionals, there are a lot of expectations on us. At times, you know what to do, but the materials to do it are not there. I'm talking of equipments and materials to have an efficient nurse. And in that situation, most of our hospitals today are not having the equipments to get the work done as a professional. That's one. Okay. Two, when we are talking of staffing, today, yes, if you go globally, there are some critical areas that is a nurse to a patient, and in some wards is a nurse to 4 patients. But in Nigeria today, reverse is the case. You will see a nurse managing 21 patients. You will see a nurse managing 10 patients, and we are looking for quality care.